So we may take a little longer to get some of these posted.
Yeah, what'll happen is before we get another note taker, I will make the comment changes and make sure that the town clerk gets all of your corrections for the June minutes.
Okay, and then hopefully we'll have someone to do these before too long.
Absolutely.
Otherwise, as secretary, I'm up the creek.
Yeah.
All right, Ray, can you pop that agenda back up? I'm down to one computer. Oh no, I have my second one. I could pull everything up. Thank you. Okay, so the next item on the agenda is the reorganization of Board of Health member positions, which without Zach and Joanne, I think if we're willing, we will table that maybe to September.
Yeah, good idea.
I agree. I agree.
Me too.
Do we need to vote on that, or is that just a?
Yeah, so why don't we take a vote for that so that we can continue this agenda item until September.
Okay, is there somebody willing to?
I'll make that motion.
Okay, Sue makes the motion, Michelle
I'll
seconds.
second.
Thank you. Stephanie Granger, aye.
Aye.
Sue
Aye.
Hammond, aye. Michelle, aye. Thanks. All right. And are we early? What time is it? We are early. I don't know if we have our people for the.
We do, so I'm gonna put them all up. We have Mark Warren, Stephen Cronin, and Hank Norton here. So let me just make sure they're all promoted to panelists. Just take a second for them to get in. Hey, Hank,
Hi, everybody. How are you? Hi, Ray.
how are you?
I'm
And
great.
Hi, Steve and Mark.
Hi, Ray.
Hi, thank you all for being here to talk to us tonight about the PFAS concerns with our water supply. Ray, do you want to?
Yeah, so if you wouldn't mind, Steve, I don't know if you'd like to just go first and just talk about some of the concerns and things that have come up with the PFAS here in town. Appreciate it.
Sure. Yep. Thank you, Ray. Steve Cronin, Director of Public Works. So as you're probably aware, we have had some detections of PFAS 6 in some of the chemicals in our drinking water wells, primarily in our country road well. It's the only well that we have here in town that's currently above the 20 parts per trillion that's regulated by the Mass DEP. As a result of that, we've been forced to essentially take that well offline currently. The concentrations are high enough that we're not in a position to basically treat that through dilution. So we're currently investigating the opportunity to treat that with a temporary treatment system. But we did receive some information recently that we expect that 20 parts per trillion to decrease. In light of that, we were notified that Hank and his firm was going to be pursuing this multi-district litigation. Because of the detections, we've already started to incur some sampling costs, treatment costs, some engineering costs as well. So on the water side, the Board of Commissioners recommended to the Select Board that they enter into this litigation as quickly as possible on behalf of the water takers. As part of those discussions, we've reached out to Ray, and we did express our concerns, obviously, that if we are detecting it in the public water system, that it's in all likelihood we are going to see it detected in the private wells also. I realize that the regulations are different, but I'll let Ray speak to what's happening on the private well side. But it's, as far as we're concerned, or at least DEP has told us, it's not necessarily a matter of if it will be regulated on the private well side, it's a matter of when. So as the information trickles out on the public water side, we do expect, obviously, that there is going to be some concern on the private well side. And there is going to be an interest from residents to start sampling. So as I said, we do anticipate that there will be some detections here in town. The source of the country road well appears to be coming from Westford Academy. It's related to the cleaning of the carpets there. So we're fairly certain of the source there. But as you've seen in some of the information that's been provided, this is fairly prevalent in other other products and other chemicals. So in Westford, where we're a town that's primarily septic systems, this stuff has been leaching into the ground for a number of years. So we do feel that there will be some isolated incidents where there will be private well owners that do detect this. And as a result, they will end up ultimately incurring some treatment costs or the cost to tie into town water at some point. So, we've been discussing with Ray the possibility of the select board, with your recommendation, entering into this agreement as well on behalf of the private well owners. We met last week, myself, Ray, and Mark, and we started to talk about some of the public information that we hope to get out there and how we'd begin to basically track some of these costs that private well owners will start to incur over the next couple of months. That pretty much sum it up, Ray?
Steve, I have a question.
Sure.
I'm over in Parker Village.
Mhm.
So I don't believe we would have any opportunity to tie into town water, would we?
So at this point in time, probably not. I'm not going to say that it's entirely impossible, but it's probably cost prohibitive based on the other alternatives there are out there for treatment. As far as providing water to the town as a whole, I think it's really going to be it's going to be probably a result of whether or not we really have a significant problem. Geographically, we're very spread out. It costs us roughly $250 a foot to install water main. In terms of capacity, we're, based on the new permit we expect to get within the next year, we're rapidly approaching our capacity as a water system. So if we were to expand in other areas of town, in addition to the cost of installing main, we'd be looking at probably installing not just additional treatment, but coming up with new sources as well. So it'd be a very costly proposition. And it's something that, we feel could be a potential result of any sort of PFAS contamination throughout town.
Thank you, Steve.
Sorry, muted. I have a question. Primarily at the country road well, that the levels exceeded the 20, but we also know that the EPA sort of dropped their levels to a very minimal level. And I also noted that, nutting was up to 19 at times. So we're really close, it looks like, at most of our wells. Is that correct?
Yes and no. There's we have 9 groundwater wells. Country Road did exceed the 20. The other range is from approximately 3 parts per trillion to 18 or 19 parts per trillion. So yeah, we're close, but at this point they are all underneath that 20 parts per trillion MCL. But as Steve mentioned, that I would say it's very likely that the state is going to lower its MCL at some point. And as you mentioned, the EPA did come out with those health advisories, which were orders of magnitude below the 20 parts per trillion. It's expected that they're going to have draft federal regulations this fall, and the following year they should have finalized regulations, finalized MCLs for PFAS, and most likely they're going to be less than 20. So at this point, we are in compliance with the state regulations, but as they change, that could change as well.
And so that, I don't know, with Hank, I guess my question for private well owners then, it's not currently something we are required to test, but it would probably be wise for people to know where they're at some point, or it may become required. But yeah, I guess so. Yeah, how is that
Sure.
going to work for the private well owners?
Well, like Steve referred to, again, Hank Naughton, Napoli Skulnick, we do anticipate two things. And this is we have a pretty close relationship with DEP. I was, in the State House for many, many years. And so know them from there, but also through this work. So we anticipate two things. One, that eventually well owners will be required to test. And I think they've already laid the foundation for that, because for the past year and a half, they've been offering opportunities in various communities to test on behalf of well owners. And the second is, again, as Steve referred to, and I think Mark did, 3 weeks ago, the EPA dramatically lowered their health advisory levels to really the equivalent of not even billions anymore or trillions, but quadrillions. And all of our water people tell us that they're not even at the level where they can test if that becomes mandatory. And we strongly believe something will become mandatory this fall. And we're also looking at the upcoming imposition of UCMR 5, that at some point well owners are going to be required to test. It's coming, and I can't say it any better than Steve said it. It's not if, it's when. And it's in Massachusetts, with Massachusetts and DEP being as aggressive or progressive, whichever word you want to use, we think it'll be sooner rather than later here. So if I owned a well, and I don't, but I live down the road from you guys in Clinton, I would be testing, and I'd want to know, well, really just for personal health reasons, but for long-term planning, to know, okay, what type of remediation am I going to do here? And I think with your board's leadership, select board's leadership, the water board's leadership, to think of including the well owners as part of this lawsuit, I think that's very forward-looking. And if the testing starts now, that's something that when it gets to the point of us either being able to access monies either through settlement prior to trial or through decision after trial, because we feel we have a very strong case, we can, if we have those figures, then we can argue on behalf of the whole town, the town as a whole, to get remediation costs back. And in the vision, if you didn't hear me, if you didn't watch the selectmen's meeting last week or other meetings, the vision of this is that a settlement or judgment will be put into a trust fund that plaintiffs, that members of the lawsuit can apply to, and bring all their paperwork that we would help them gather to the trust, to the administrator of the trust, and say, okay, we need X millions of dollars or whatever figure for remediation and for bringing potentially, well, whatever your remediation program is.
Thank you.
I hope that answered your question.
Yeah, Sue or Michelle, did you have any questions?
No.
No, I think I'm all set. Thanks. Oh, I guess I do have one. So
Sure.
if I wanted to have my well tested for PFAS, how would I do that?
So I
Sure.
think Ray has something up on the website already about.
Yeah, so if you'd like to get your well tested for PFAS, right now we have several certified Massachusetts laboratories within 20 miles here to Westford. The average cost when we did the survey was about $400 for PFAS for a private drinking water well. Remediation prices range anywhere between the hundreds and thousands of dollars, depending on point of entry services, or if you're just looking for some remediation from, say, a kitchen sink. We've been working, as Steve and Mark have spoken to, we've been working really hard on how do we notify the private drinking water well owners, how do we let them know. So we have updated our website page. We've worked with the water department to link our page to them and them to us. We're working with our IT department to set up an email address where any private drinking water well owners can upload their testing, their contact information, any remediation system that they need to put in, so that if and when there are any requirements or funds available for them, that we'll have their information. I think
Thanks, Ray.
that's pretty much it.
So I had the one question that I spoke with one of the the water treatment people, I think, from the list, and they only spoke about the filtration at like the kitchen sink and did not speak about a point of entry. But I did see that on the DEP page. And does anybody know anything about what those options are, or how people find out more about that? When I spoke with the person, they're like, yeah, no, there's really nothing other than this kitchen sink filtration.
So-
Right.
I'm going to say is I really don't know much about either point of use or point of entry systems. One thing to keep in mind, though, is that you got to pay attention to the details, because I think a lot of these systems are geared to remove PFAS to the EPA, well, the previous EPA guidelines of 70 parts per trillion, and they do probably go a lot lower than that. But if you install a system, I guess you'd want to know how clean the water is, how much PFAS you're getting out.
So it might be worth it to wait until the fall to see where we're at in the fall.
Yeah.
Just, I'm sure that if, any well water owners are listening to this, they're probably wondering what options are. And I have a well, as it sounds like Michelle does. So
Right.
it's a.
Right. And, here at the health department, we're working with our well companies to put together a list of not only well companies within the area, certainly, we don't recommend any particular company, but that specialize in PFAS remediation. And as Mark said, you as a consumer, you really want to pay attention to how much PFAS that system is going to remove, and to what devices in the home that the PFAS will not be eliminated completely or eradicated. So more education to come for the public. And then if they have any questions at all, they can always call us here at the health department.
And I guess the last question I would have is, in terms of the litigation, we just will wait and hear from the select board and how that proceeds. Is that
The select board is, as I said in an email to Ray, the select board is the retaining authority, the contracting authority. So really, technically, they're the client. So I can share, as I did today, kind of generic answers to your questions, but the more in-depth questions about the litigation, that would kind of be for probably an executive session with the board, and then they could decide where they want to go from there. But as I said, I'm always happy to kind of answer generic questions of things that are in the public domain, and that you can pay attention to.
Thank you very much.
Thank you very much, Hank.
All right. Thanks a lot. Have a great night. Always good to see you.
Really appreciate you all coming here to speak
Thank
with
you,
us
Mark.
tonight.
All right. Good night, all.
Thanks, Steve.
Okay, so yeah, I will just reiterate that I did check. The health department has a PFAS tab on its side set of places that you can select, and it had a lot of information there with lots of good links to help understand this concern. So thank you, Ray, for getting that, and for
No
getting
problem.
that up there.
Sure.
And I guess with that, we can move on to our ARPA update and discussion.
Okay, great. A couple things with the ARPA requests. We do have a few requests in, as you know, to the select board. In June, they had a scheduled meeting, and I know a bunch of not only residents, but a few board members were in attendance for that meeting. But for the ones that weren't, I just wanted to update you. Hi, Joanne.
Yeah, let's just let the record know that Joanne is now joining us for the meeting.
Hi, Joanne. So as I was mentioning, in the June meeting for the select board, the select board did decide that they wanted to move the ARPA request, the new request, and some of the existing requests until August, when the second half of the ARPA funding came into the town. So we've been waiting. At first we thought maybe July, but we're hearing August now for our requests. And so in the meantime, we are pulling together support letters and answering all questions that any of the select board members have. And again, just to reiterate, we do have a dental program request in. We have our community health assessment and improvement plan request in, and a recent collaboration with the Council on Aging for assisting folks that need help with housing. So that's pretty much the request. We're waiting for the date when they do go over those requests and see what happens. I'll let you know.
Can I ask a question?
Sure.
When I was going through, the package, there was something about an amount of almost 52,000 and another amount of 16,000. One was from a PHE grant and COVID-19 PAC grant, and it says that's to be used that's completely to the health department. Am I correct? And what is that? That's part of the ARPA, or I was a little confused.
Sure. So the health department has two large grants through the Department of Public Health, DPH. One is a COVID-19 grant. So these are regional grants. So we share these grants with 4 communities, Westford being one of them, Acton, Drake-It, and Lowell. The COVID grant is $111,000 and change.
Yeah.
And so as part of that, we receive an admin fee, the town of Westford, because we are the host agent of that grant. And that runs about a little under $17,000 that the town receives. The second grant is the Public Health Excellence Grant. That grant is $345,000 per year. So it's a little over $1 million over the lifetime of this particular grant. Now with that grant, again, regional, we receive, it's a little over 54,000 this year in admin. Moving forward, it'll be 44. So, with grand total, a little over $65,000 that the town receives, and that money goes back in the general fund.
So it's not, when I read the letter, it sounds like that from that Lizzie, she said there's no reporting requirements for how you spend it.
There are reporting requirements, there are no reporting requirements, but there are requirements to that admin money. In other words, one being you can't supplant an existing position. So, if they can't give me a stipend or, accounting, or we can hire additional people for the grant with that admin money. We can use it, for instance, the select board mentioned defibrillators. And
Great. They mentioned what?
Defibrillators that the fire.
I saw that. Yeah.
Yeah, the fire department was looking for defibrillators. So I think it was a little more than 14,000. And so this is something that this money is available. If the select board or the town decides they want to use these general funds to pay for other things, they can certainly do so.
But these grants came into the health department?
Correct.
So I'm confused why they then go into the general fund.
So according to our accounting department, it isn't something we have to take it out of our accounting. Our accounts, we have 4 accounts set up for these grants. This money needs to come out and per law needs to go back to general fund. And then any money that's left in the grants, that we haven't spent down, goes back to the Department of Public Health. They have to be spent down by the end of the fiscal year, which was June 30th.
So it doesn't have to be used for health-related issues?
It does not.
That seems very.
Joanne has her hand up. Joanne.
Oh, I didn't want to interrupt Sue because I think you were going to say what I was going to say. Like, why? I understand if I know from other grants that isn't the case. It reverts back to the health department for the administration of, because of the work that you're doing. So if they're telling you by charter or whatever they think is appropriate that it has to go into the general fund, why then don't we get it back in, or some of it at least back in our budget?
Exactly.
Since
Yeah.
it's the grants that you're writing, that the health
Mhm.
department is bringing into the town for to enhance and bring new services to the residents, yet the administrative overhead, which we're allowed to take, the 15% on most grants, is then getting turned around and used for whatever.
Mhm.
And at the same time, you're getting raked over the coals because the fire department wants AEDs that you didn't know anything about. They can come out of opera money. I don't understand. I don't understand. I just don't. I don't.
It just
I don't
seems-
understand what the problem is. I don't know what Andrea's issues are, with this nitpicking, and why the fire department doesn't have anything in their budget, and they can go get ARPA money for defibrillators. There's thousands and hundreds of thousands of dollars. It's
I
annoying.
don't get it.
Well, and it just seems wrong that this is an administrative fee for the administration of the grant, which is being done by the health department. Nobody else in the town has anything to do with this grant. So that money should stay with the department to be used to
Nope.
cover.
So should we ask for an opinion from legal counsel?
That's a good idea.
Yeah, because this is ridiculous.
Mhm.
There are so many things that we are not being given the funds for. And here we have a little bit of money that we could use to increase our community education, to print materials, to send materials, to reach out with contact materials, to cover any other administrative things. Can you use it for computers and things like that, to update equipment?
Well, if it goes back to the general fund for anybody to use it for whatever, then in the health department, we should be able to use it for whatever. Why don't we increase the vaccination program, buy more vaccines? Why don't, at least it should go back to the health department for
Yeah,
health
100%.
related projects.
Well, again-
not to, asphalt for down the road.
I still think, my argument about mental health is always going to be that. I've been told over and over, there's no money, there's no money. And this kind of stuff, hearing this just sends me over it's not okay.
No.
It's just not.
Yeah,
No,
so I think it'd be good to ask legal for, these are funds that should be for the health department to use, period. Whether they have to go back to the general fund, but then they should be ours. And it seems really strange.
Well, and I mean, even you that from now, who is Lizzie? Right.
So she works with BME Strategies, who's our consultant, who is our accreditation coordinator and grant manager.
So again, she's saying to you, not to the town. Remember, there are no for how you spend this and how you see fit. So again, does she realize that the money is not how you see fit, but how the town sees fit?
So she's reiterating that the Department of Public Health has said, listen, these funds are for you and that you can use these to your discretion, within the limits. Like I said, you can't supplant and other items. But I don't think they understand, again, I don't know all the legal ramifications. I'm only going by what the accounting department is telling us. And I'm certainly happy to check with legal to see
I
what
think
can
that's
happen.
great.
Because, for us, it's not just our department, accounting, our administrative assistant, it's invoice after invoice. It's lots and lots of hours for these grants right now, and for purchasing materials, things of that nature. So even with the assistant town manager with procurement, it's a lot of hands that help. So I will definitely check. I will just mention too that the town received an earmark from Jim Marcerio for $340,000. I did meet with Jody. I mentioned it, I think 2 meetings ago. And $40,000 of that money was set for mental health services, 10,000 of which was set for supplies for the health department, such as shelving for emergency preparedness and whatnot. So I just wanted to mention too that money, I know that doesn't help with your concern, but I just wanted to mention that too.
Thanks, Ray.
Yep,
So Ray,
Yeah.
you said $300,000
yeah, it was $340,000.
and we
Yeah.
got 10.
We got 10 for
Where's the
supplies
rest? What's the
and
rest
40,000 for mental health services. The
And-
rest,
and-
it went to HVAC for the schools and the community, the council on aging.
Okay,
It was earmarked for COVID-19 related items, which was for ventilation, air quality, and COVID-19 supplies,
okay.
related supplies, excuse me.
Okay, so let us know, please, if there are meetings upcoming to discuss again our ARPA requests so that we can be present.
Absolutely.
Any other comments or questions on the ARPA? If not, then we can move on to our update on the vacant positions in the health department.
Yay! So a couple things, health agent's position, we did go out on a round of advertising. We advertised through MMA, Massachusetts Health Officers Association, Indeed, internally. And unfortunately, we did conduct several interviews. We didn't have any candidates that met the credential requirement. So we're a little disappointed with that, but we have gone out again. And so we are currently reviewing applications that are coming in. The food inspector position, we have received quite a few applications and it looks really promising. So Abby and I are discussing setting up times next week to see what we can do for interviews. And so if anyone would like to be involved in that process, we'd be happy to have the help. And if not, that's okay. So I just wanted to let you know that it is moving forward. We see light at the end of the tunnel for these positions. As you know, it's difficult to find help right now. And there are a lot of health agent positions that are listed right now, both on MMA and MHWA. So just wanted to bring that to your attention. The tobacco, yeah, one last thing, the tobacco request we have in for ARPA. So I know at the last meeting, there was a request to look into contract positions for those tobacco inspections. And so working with that process, I did talk to the Department of Public Health with our Public Health Excellence Grant. They did just let us know this week that the Community Health and Wellness Coordinator that we have, which is regional, they did give approval for tobacco inspections. So that is something that, I'm currently looking into with HR. Ray Peach's position, who was the substance abuse coordinator, that is a union position, but it's still in the books. So it gets a little touchy with the union position. So I'm checking to see, if this is something that we can do. Brittany Nash is open to learning it, doing the inspections. She has the time. She'd be conducting for Acton and Westford. Again, we're in the early stages. I don't know if this is something that will be viable, but we're looking at every avenue. There's unfortunately no grant funding available right now. I did speak with the States Collaborative for tobacco, and they don't have the funding right now to take on Westford, or Acton.
So if we had that funding from the administrative funds back to the department, would we be able to use it to pay for a consultant or position to do this?
Yeah.
We need that money where it should be.
That's how, when in my prior job, we had a Title V revolving account and we paid for, contractors to help us at certain points.
Because
Yeah.
it's great if we can get Brittany, we have permission for Brittany to do it, but does she have other things she should be otherwise spending her time on?
So Brittany certainly does have a full schedule right now, but this is certainly something that we could, again, it's an idea, it's something that we could certainly work into her schedule. Westford has 20 establishments. I think Acton has less than 30. So, again, talking with her, this would be something where she could conduct inspections. Again, it wouldn't be the full tobacco program. She would follow up on fines, you know, it wouldn't take care of the whole position as far as going to court. That would be something that I'd have to fill with my position. So again, just still in the early stages of investigating to see if this is even a possibility. But I know at the last board meeting, they had requested, you know, looking into a contractor, looking into other options. So this is where we're at right now. But
Did
I
you
can-
get an idea of the cost of a contractor?
So the cost for a contractor would be anywhere between $45 and $65 an hour per inspection. And then about the same price for any kind of re-inspection. And, you know, here in Westford, we have an electronic system. So we would need to take the paper copy and transfer that into the electronic system that we currently have. Go ahead.
Sue?
So I would be hesitant to have Brittany do it. I think if we have her do it, it's not really going to solve our problem, right? It's almost like, okay, I would rather see a contractor. I would rather see the money come from this administrative funds that we say are to be used at your discretion. That would be a better use of the funds, if you ask me. I don't like the idea of we've hired this person to be, you know, this, you know, coordinator for different towns, and now all of a sudden she's going to be doing our tobacco inspections. I'm not comfortable with that. That's just my personal opinion. I'm, you know, hearing all this, I'm like, I could just see that being, okay, now we have this woman who that's really not what she was hired for. And she's going to take over this when there is funds that, you know, and I would really like to see Brittany, you know, doing more with mental health and more, you know, I mean, that's just my own feeling.
It's
I
not
just-
just you, Sue, though. We know that one of the primary concerns of this town is to focus on mental health. We should use the people who are
That's-
trained and skilled in that to be focusing on that, and
Mhm.
use the other funds that should be in the department to deal with the other issues that the department needs to deal with.
Right. And that was my argument about, you know, well, could Gail take it on too? And that would give her the extra day. You know, we shouldn't just be tacking on duties to people and giving, you know, oh, you can do this for 5 hours and you can do that for 5 hours. And you like, that's
I don't
just
think police
craziness.
and fire
And
would be doing that. I don't think other
nobody-
departments would do that.
no, they wouldn't, and they shouldn't,
They shouldn't.
because we should be able to get the employees that we think we need for the community. We had this position and we need it back. And, you know, things evolve and you get somebody that, you know, we all loved Ray, but we also know too that, you know, the position could have been expanded into something a little bit more. And
Oh, you're on mute.
You're mute.
sorry, I'm getting angry, like
It's okay.
button. But I mean, if you find somebody, like you were saying, your job is mental health and that's what you should be doing. We should find somebody that this is their job and that's what they should be doing, not plugging a few hours here or there into other people's day because we have a deficit. That's not how
Mm.
this should be run.
If
And
we, you know, sharing the position with Acton, that could be a reasonable approach. It could definitely be a shared position, but it should, or a contract based if that's what it has to be. But yeah, it just tossing it in where somebody can't do the full job and it's not right.
so Ray, I have a oh, and I meant the other Ray, not we love you, Ray, because we love you, Ray. There's too many Rays in our world. So we just got our public health excellence grant. And when in our job descriptions, we did add tobacco into one of the inspectors' categories because we just got the grant. You know, I know you talked to DPH. Is there a way to look at maybe not this cycle, although it's 3 years, but if there's a way, because they sometimes will, you know, help you because they want the grant to succeed, to rework and maybe add another position to that
Yeah.
grant. And then have, you know, obviously Lowell's all set, but, you know, maybe Drake needs a little help, and definitely Westford and Acton.
Yeah, I have reached out to the Department of Public Health to not only see if they can add more funding to the tobacco collaborative, so Westford could be, it could be absorbed. But I have asked if, put a request in to see if there was an extension on funding or for additional contracting services, a position. Certainly something we'd love to have. I know they did come back with, the grant is level funded this year. They hope maybe in the future. But as you know, the second year is starting, it just started for July 1st. So, I will certainly look into see if we can open a revolving account with this admin money or, what options are available. I'll mention legal counsel and see what more we can do.
Thank you, Ray.
Sure.
And some nice ideas there, Joanne. Okay, so then I guess we're on COVID-19 education and recommendations and the free test kits.
Yeah, so we're really excited to report up until today, I believe we have 46 positive COVID cases here in the community. We're excited because the numbers are still staying level and dropping. I will say that the BA.5 variant is something, as people are noticing in the news, it's a subvariant of COVID-19, which is highly contagious. COVID has not gone away and probably won't. So we do want people to be aware of, everything we've been saying for the last 2.5 years, with keeping with their sanitizer, washing their hands, staying away from folks that are positive with COVID-19, getting tested, vaccines, up to date on your vaccines. If you have any questions about your boosters, where you can get an immunization, you can certainly call here at the health department or visit our webpage. We do have, we received about 4,500 test kits here at the health department. So we have supplied the library, the public library. We've supplied our senior center here, Cameron Senior Center. And here at the health department on the second floor, we are giving out lots and lots of tests daily. So those are free. If any family, we're giving 2 boxes, which is 4 tests to each family. And so you don't have to show proof of anything. We're just giving those out. So we're open Monday through Friday, 8 to 4.
Great, thank you. And yeah, just a reminder that with this new variant, that's the dominant variant now, it is evading most previous immunity. So we are all susceptible, unfortunately.
I just have a question.
Yes.
I think at one of the previous meetings, Ray, you had said something about Gail was looking into setting up a vaccine clinic sometime this summer. Is that still in the works?
It is. So we are actively looking at a shingles vaccine clinic for the public and expanding our booster clinics for COVID-19. As I mentioned at the last meeting, our department is capped, or I should say was capped at $60,000 per year to spend on vaccines. Well, with the increased cost on vaccines, we hit our cap and we haven't been able to provide any clinics this summer. So that went to town meeting in June. I requested an increase to $75,000 per year. That was just approved. So as of July 1st, which Gail and I are working right now to working with the insurance companies, the shingles vaccine is quite expensive. So we are looking into all the preparation to put that clinic on. We're looking to end of August, early September, where a lot of people are on vacations and not around. But those are something that we're actively working on. We're also looking at the flu vaccine, as you know, and we're hearing a lot of scuttlebutt about a COVID-19 vaccine that you'll be able to have not only your COVID-19 booster, but you'll be able to have your flu at the same time. So we're preparing actively for that. We have set up flu clinic dates and we will be releasing those next month.
Thank you. And the best place for people to see information as it comes available on that is just at the health department website.
Definitely the website. They can always call the health department. You know, we have folks that are social media, big on social media, so they can always call here or look to our webpage. We will be sending out our newsletter at the end of August, which will have all the flu dates. Those go to every household. Also, any up-to-date classes we're offering, seminars and education. And as always, we put it out immediately out on social media, so you can follow us on Facebook.
Thanks, Ray. All right, and now new and old business.
Sure. So again, just the grant updates. We're at the end of our fiscal year, so we're closing out year one of both our PHE grant and our COVID-19 grant, which is a one-time grant 1 year. So we have purchased a big supply. I put in your packet of medical and non-medical items, wheelchairs, emergency preparedness, and everything from picnic tables to medical supplies. You name it, we took advantage to all of the items that we were able to purchase. We were able to purchase picnic tables for folks that aren't comfortable going in, to pick up items during COVID for both the library and the town hall. We ordered things like portable AEDs for all of our clinics. We were able to purchase vaccine tubes, and again, a whole plethora of medical supplies to load up all of our clinics. Medical shelving, things like that. We're working really hard to pull all of our resources that are kind of scattered around town and put them in a location, one location that's organized. So that's something that Nancy Burns and Gail and myself, the public health nurse and our MRC coordinator, are working hard to pull that all together.
Have you got a storage location that's sufficient for all of
So
our?
yeah, right now we have a facility over at the Millennium Building. We have some closets there. We have some classroom space, and then we do have trailers across town at one of the schools. So we're kind of working to coordinate all of that and make sure we have the right supplies in the right place and that they're organized, labeled. And again, with all of this funding, it's really been a huge help with being able to purchase metal shelving, containers, and equipment. So we're really excited about it.
Great.
Update on 115 Concord Road. This is, I'm not sure if all the board members were here last time when we discussed this case. This is a recent case where there was a housing inspection, the spill of petroleum on the property. It was an old asphalt business that took place on the property. So we went out to inspect that, Abby and myself, with our conservation department. And there's quite a few open tanks, old tanks of all various sizes. So we did what the DEP was informed. We've been working with them closely. The site was determined to be a 21E site. The homeowner was required to hire a licensed site professional or an LSP. And so I spoke with the LSP last week. They have been sent orders. They have a timeline for cleanup. And it was kind of interesting. They said, wow, in all my years doing this, I've only 2 health departments have ever called me regarding these kind of sites. I said, well, we're very interested in the cleanup. So, and so is our conservation department. So we are working closely with the DEP and LSP to make sure that this site everything is addressed. So we've gone over everything with them: the soil, water contamination. There's a berm on the site that's made of recycled tires, and like I said, all the tank removals. And we want to make sure the soil is clean and there's no water or soil contamination. So there's a private home on the property. This is a garage way in the back of the property. And again, the homeowner has been very, very cooperative and receptive. So it's a process though. There's a 120-day timeline. Each 30 to 60 days is something new that they need to meet. So we will make sure that we're following this.
Great, thank you.
Mhm.
And 472.
Yay, 472 has been closed as of last week. So we're really excited about that. As you know, this was a long-term 4 years. We've been working with legal counsel. So we're very excited. The house has been demolished on the property. The last thing I was waiting for is to see that the court-appointed receiver was able to fill the exposed and abandoned leach pit, and that was confirmed last week, so we can close the case. And legal counsel will work with the court to make sure that the case is closed.
Great job.
Yes, that's good. All right, well, is there any other old business that anybody has to bring up or new business? Seeing none? Oh, Joanne?
So I apologize for being late. I had a personal thing pop up, but and I know you've already done the minutes. I just want to make sure that I'm not absent and in attendance. Did you fix it?
On this, oh, in the last minutes? No.
Oh, we will.
So I don't know if you have to go make a motion to go back to the minutes because it says that I was present and absent. I am special,
You're a
but
ghost.
not that special.
You weren't there, I don't think.
No, and you know what? I know there was a meeting sort of like this one that I did come in a little bit late, but this wasn't it because reading through the rest of the minutes, I'm like, I don't remember
You
any of
weren't
that.
there.
So
Yeah. Yeah. You
Okay.
and Zach were missing.
Well, I guess I can make a motion to add an amendment to the June 15th minutes to change, to make sure it notes that Joanne Belanger was not present,
was absent.
was absent. So I'll make that motion. Is there a second?
I'll second.
And all in favor, Stephanie, yes.
Aye.
Michelle, yeah.
Michelle, Sue, yes, and Joanne, yes. Thank you.
Thank you.
Good catch. Okay, and then
I was like, that's pretty cool.
very magical.
Very magical.
All right, do we have a motion to adjourn?
I'll make the motion. We're all gonna make the motion.
Michelle, I saw Michelle's hand first, so Michelle makes a motion. Is there a second? Joanne got it. All right, Joanne seconds. All in favor?
Aye.
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 Okay, that motion passes unanimously with Joanne, Michelle, Sue, and Stephanie voting yes. Thank you, Abby and Ray, for all you do.
And
Thank you.
and Ray, thanks for all the updates.